Hi everyone, welcome back to my channel. My name is A Cup of Elsie. It's going to be an interesting topic today. Today we have Dr. Ralph. When it gets to time, I'm going to let him introduce himself. But we're going to talk about mental health, and who else to talk about it than the expert himself? We're trying to bring you a series every now and then on mental health, and he will be the right person to show us some of the strategies to catch these these illnesses or issues that is in the communities. So I'll let Dr. Ralph introduce himself and we'll delve right into it. Dr. Ralph.
Hi, my name is Ralph. I am a psychiatrist in training in Ghana. I work out of Ghana, based in Ghana. And I am a medical doctor. Psychiatrists are different from some psychologists in the fact that psychiatrists handle the medical complications of mental health. So I'm happy to be here with you today. I don't know how this is going to go, but this happens to be like the first run, so I think it's going to be a Q&A, right? So
Yes, yes. So thank you for introducing yourself. Essentially, we want to understand the basics. So when someone says mental health, for me, it's like, oh, somebody has a disease of the mind, right? But there's nothing really technical to saying somebody has a disease of the mind. I don't know some of the effects, some of the issues a person may go through. So as a doctor in that field, what is mental health?
so there's a standardized definition of mental health, but then to not bore anybody, I'll take the most important things from the definition. The definition supposes that for somebody to be in good mental health, they need to be able to live their life to the fullest. So anything that derails that particular goal is something that's impacting your mental health. So mental health, I tell most people, is like dentistry. You don't have to wait for your teeth so bad to access mental health services. So it's a spectrum. There's a normal spectrum of mental health. There's an abnormal spectrum, and just like people would go for regular wellness checks, and then people go for regular dental checks, people need to prioritize mental health checks, even if they're not necessarily ill, because you don't want the car to break down before you go to the mechanic. You want to do proper maintenance. So, ill mental health, anything that will keep you from achieving your life's full potential. And it can be the regular ebbs and flows of life to full blown illness. That I'm sure a lot of people know about, like illnesses that are, how do you call it, characterized by delusions, hallucinations, um, social withdrawal, inability to go to work or enjoy things, function. The most common, or one of the most common illnesses, is depression. Depression is as common as, let's say, cavities for a dentist, or let's say obesity when it comes to non-communicable disease. So it's the most common, and it is the most common reason for morbidity on the planet. So mobility adjusted years, mobility means being unwell. So having a period of unwellness, when you look at all the things, all the healthcare components that can cause people to be unwell, depression is like the highest. And this is all conditions combined. So mental health is really important because if you cannot function, then you might as well not be here. If you have physical illness, you might be able to function even though you might have this inconvenience. If you have moderate to severe mental illness, your total holistic functioning is severely impacted. It doesn't matter if your legs are working, your limbs are working, even if your mind is still astute in certain instances. Let's say you are still very good at calculating things. You might say, hey, I'm still intelligent, but then mental illness can actually derail all of that. So that's just the background I'd like to give.
Thank you very much. So I heard you mention things like depression. How do I know? Like, that's a broad definition, right? How do I know that I'm depressed or I have mental health issues? Like, just because I'm socially withdrawn from people, does that just automatically categorize me under that?
So everything in mental health for psychiatrists, psychologists, and other mental health professionals like social workers, blah blah blah, everything is criteria. And for most of our criteria, we begin to take them seriously when people's lives start to go like off the tangent. So whenever something is severe enough to impair function, you know that it is an illness or it is taken as a mental illness. So there's a spectrum. Just like I said, dentistry, people have clean teeth, some people have white teeth, some people have white teeth, some people have brown teeth, but then they might not necessarily have a problem with it. But if you have a cavity, you know you have an issue. If you have like something growing in your mouth, you know you have an issue. So mental health is the same way. Somebody might be introverted, and because of that personality trait, they don't like to be with people as much as other people that are extroverted, who might actually have issues when they don't have a lot of people around them because that's how their personality is. So the same way we have personalities, we have personality disorders. So it's a spectrum. You can be have one kind of personality, then with time we realize that oh, there's certain things that are weird about this one particular person. Why is it so weird? Then you realize that oh, they fit the criteria for an actual illness or an actual disorder. So even if you don't have a mental illness per se, you can have a personality disorder which deviates from the norm when compared to all other human beings. So we have like I'm saying neurotypical, neurodivergent, and it's like sharing people's brains don't run just like the rest of us, but then they still run. So there are certain things that I might realize might have off socialization, social cues, fixations on other things. And for the last two things I said, whenever you start realizing something like that, it might be leading towards like a diagnosis of autism spectrum disorder. So there's so many different things when it comes to mental health, mental illness, mentally or being mentally unwell. But then generally speaking, you asked about depression. Depression is used, so mental health is English. Most of our terms are not like cardiology, where you might have very typical, very technical terms. But a lot of the mental health terms are on the spectrum of regular English. So people use depression informally. And for mental health practitioners, depression is a term with fixed criteria. So the current criteria for depression is mainly two symptoms. The first symptom is that you are you have very low energy. So there's a very low energy or drive to go about your daily activities and do certain things, you know, with coupled with lots of interest in things that you were prior doing without a hitch. So there are things you like to do and there are things that you do, whether you like to do them or not, but you have the drive to do them. So for whenever you have loss of interest coupled with that kind of low energy, it signals that you're probably depressed. The second symptom is what I'm sure, as the name implies, you're very sad. So you have a very low mood, you have a very low disposition to things, you don't see the light in your day. You can put on a smile, put on a hard face, but internally, you have this subjective feeling of severe or very serious sadness. So that's the second symptom. So when you have these two symptoms combined, they serve like as the basis for diagnosing depression. So depression is if you have these symptoms for a minimum of 2 weeks, most of the time within that 2 week period, minimum. For a lot of people, when they are actually diagnosed, it's longer than 2 weeks. They might end up with a mental health professional at the 1 month, 2 month, 3 month mark. But then when you have it this severe, person is very sad, they are very dejected, they feel like life is not worth living, you know. Then we'll start talking about severe depression, which is like characterized by suicidality and other things. So when somebody has that kind of loss of interest and low energy, coupled with an intense subjective feeling of being very sad, then you can make a diagnosis of depression. So we have three different levels of depression. There's mild, there's moderate, there's severe. There are other criteria. There's about 5 to 7 other criteria. Losing appetite, or the opposites, eating too much, or losing sleep, sleeping too much. So whenever it's the opposite is atypical depression. We'll talk about that later. That's conversation for another day. But then weight loss, problems concentrating, completing tasks, memory issues, feelings of intense guilt, feelings of insufficiency, not good enough, I'm worthless. I don't think I make the cut, even though there's there's a lot of evidence to show otherwise. So somebody might be an honor roll student, and all of a sudden they feel like all of that is for nothing. They don't feel good about themselves, even though they are producing results, or they were producing results before the depression started, only because something triggered it. They might have experienced like a severe loss, or they might have experienced like a very important relationship to them that was kind of cut short, or monetary issues. They are not doing, they put in so much work doing something. Let's say you put in the last 2-3 years, there's a PhD, something project you're working on, and then the whole lab goes away, blows up to smithereens, either figuratively or not. Maybe the whole research, it looked like it was something that was for naught. That kind of thing can trigger an episode of depression. So depression is more of like an illness because it is reproducible in different people. And we know that it is progressive if it's not treated. There's a natural history of depression, but a lot of people will get better. Some will never get better. It will keep going and coming. Some will be ill enough to either become completely non-functional or complete suicide. So this is how depression can go. So the symptomatology, as I discussed, the more symptoms you have, the more severe the depression is. So let's skip moderate and go straight to severe. How do I know somebody that I love or I care about, or somebody around me, a coworker, is having a severe illness? This is how you tell. So for severe illness, they usually have all the symptoms combined, and they might be suicidal. They will have suicidal ideas that they will not tell anybody until somebody asks them, because people process suicidal ideas differently. Some people are embarrassed they have suicidal ideas. That's a good number of people. And if I had suicidal ideas, I'd be embarrassed to tell anybody too. Some people accept suicidal ideas, and because they accept suicidal ideas, they will be making a plan. And when they are planning, because you don't want anybody to stop you. So both groups of people have this outcome. They don't tell anybody because either I'm too embarrassed or I actually like this idea. I don't believe I should be here. Let me just keep my head low and plan and go out. And the thing that we like to talk about is the fact that if you had an illness like diabetes and you had to lose your leg because of it, would you blame yourself as the human being or the illness? Would you like to answer?
I guess I will blame myself because the illness wouldn't come because if it wasn't for my way of life, right? Because it's lifestyle. If you're type 2.
That is actually exactly. Even for type 2s, like there's a good number of type 2 people that try interventions and take medication, but then they still can't get their blood sugar under control. So there's a good number of people that could be better. But there's a subset of people where no matter what illness they're given to, diabetes is a good example, but it could be anything else. They have the short end of the stick, no matter what you do. For example, type 2 diabetics are known to be overweight and obese and have insulin resistance. And if you reverse this, you can cure the illness. I'm sure that's like a lot of people know that fact. But there are some people that can be very skinny and still have type 2 diabetes. So they have less of a chance of reversing it. There are people that have type 2 diabetes that might be on a certain kind of diet that is very weak but them. That's the funny thing about medicine. We call it idiosyncrasies. Somebody can have the worst version of something and it's not their fault. It's the same in mental health. Somebody can have the worst version of schizophrenia and they will literally not be functional. We'll give them all the medication, give them all the whatever, and they will not be functional. So the reason why I use the analogy is that when you are depressed, irrespective of how you got the depression, it is not you, it is the depression. So whatever you decide, exactly, whatever you decide under an altered mental state, you are not liable for. And that is why most of the world has advocated for decriminalization of suicide. It's about 70 to 80% of the planet now that have decriminalized suicide. So it's not a crime to kill yourself or want to kill yourself because we know that for a vast majority of people, they will be under the influence of an illness. So you don't blame them, you blame the illness. If they cause the illness themselves, that's a different thing altogether. But as long as the illness is the direct cause, we blame the illness. So it brings you back to the case that Most suicidal people, if they were well, will not want to be suicidal. You know, most diabetic people, if their blood sugar was normal, will not lose their limb. It's the same kind of analogy.
I
So
think I have a problem with that because, and for example, the diabetes that we're talking about, right? Yeah, if somebody is diabetic, like for the type 2, right? We know that they say it's lifestyle. And so getting there
that's
is how
from
you.
medical. No. So from medical research,
Mhm.
it's a vast majority that are
Okay.
lifestyle related. It's a very big percentage that have no reason.
To have no
There's a very
reason.
big there's a
Okay.
very big percentage of type 2 DMs that do not have any lifestyle risk factors.
Okay.
That's the point a lot of people gloss over. There's a lot of people. It's like having familial hypercholesterolemia. It's the same thing. You can eat as clean as possible. Your cholesterol will never go down because you
Hmm.
inherited the right polybiome of genes. And this
Okay.
is
So
fact, like, yeah, there's a good number of people. I always tell people that, especially when I was working in mainstream medicine, I know we are kind of on a different trajectory now. But then there's a good number of people that will come with the societally acceptable reason for developing like metabolic syndrome, low exercise, eating really bad, high processed foods, high sugars, blah blah blah. What if a patient comes to you that doesn't have any of those things? What are you going to tell them? And
hmm.
for doctors that are working, physicians that are working, those are at least 20 to 30% of their patients. They come, they're skinny, they're eating a regular diet, they're eating a diet that people are telling them, and they still have it. It's like cancer. There's research that shows that certain bronchogenic carcinomas only occur in extremely healthy women. I don't know if you've heard of this. There are papers that show that there's a certain subset of cancer that comes in the people that eat the cleanest, that have like the highest like exercise, everything is right, and they still get it. So it just shows it just predisposes them to the fact that we don't know everything, and at the
Hmm.
same time, you can't protect yourself 100%.
Yeah.
That is yeah, one of the I had a very long non-psychiatric history, medical history, and one of the biggest mental struggles I realized for people that were terminally unwell, whether it was a cancer or like a non-communicable disease, like a heart disease or something, was I did everything right. Why did I still get this? And it can put you into the worst kind of depression.
Hmm.
That's a funny. It can put you into the worst kind of depression because I knew all the facts. I did everything. I went to the gym all the time. I only ate natural food. Why have this illness? And that shows you that the doctors don't understand everything. Neither does research. That's why we do ongoing research because a couple of years ago they said eggs were bad. Now research is showing the opposite. People believe eggs
Yeah.
are good. People believe organic food is good. There's research that came out of Italy that shows that organic food doesn't make a difference when it comes to like they did like randomized control cohorts and they realized that whether it was organic or not, there was no advantage. So I
Hmm.
feel like life will throw you curveballs, and that's one of the things I realized as a doctor working through everything. And mental health and mental resilience is where all those curveballs meet in the middle. So you might do everything, and then you will get a poor outcome. A lot of people, and one day, one of the podcasts we'll talk about cognitive distortions and the way that people think that I am the most. Let's say I am the most. I don't use the word goody two shoes, but I am the most compliant and I've done everything right. Why does bad stuff keep happening to me?
I think that's
That's the
something everyone kind of talks about. Like
yeah.
you live consistently and then something will still happen. And that would probably lead
That's
me
the
to
average.
my next question for that, like just in that same line would be, does this mental health or depression disproportionately affect certain kind of groups? I know, like you said, in general, you can have a bad day, money issues, a day or two, sort yourself out. But is there a particular group that this really affects?
So there's research, now medicine is evidence based, and then um, not just medicine, but science in general. So when it comes to the science of depression and around depression, we know that the risk factors for depression are regional, they change, and there's different research, different like systematic reviews, stuff like that, that show different things. So the answer to that question is ball is still out. But then we know certain things. Depression is a very heritable illness. So if your parents live with depression, you are very likely to depression. Depression has a female preponderance, and some studies show otherwise, but it's generally accepted that there's a higher risk towards females than males. But then it's also known that when males are depressed, the the severity might be more. They are
Mm-hmm.
also harder to pick up because they don't discuss their feelings, and it's all because society and how society is wired to keep men strong. Men are supposed to be strong in most cultures. Men should not voice out. Men should not be vulnerable when they have
Mm-hmm.
issues. And this is across board. It's whether in the third world, first world, second world country, in the west, in the east. It's generally men are supposed to be protectors and providers. Protectors and providers don't have problems of their own. They're supposed to nurture and then absorb everybody else's problems and come up with solutions. So that men are supposed to be solution oriented paradigm is one of the reasons why men's mental health is so important. Another thing that I know, or that we do know as a group of scientists worldwide, is a risk for depression is low socioeconomic status.
Mm-hmm.
In some research, it shows that it doesn't cut it doesn't cut through every culture. With some cultures, because there are no classes or there are no castes, and they have the power of community, low socioeconomic status is not really a problem. But generally speaking, for most of the places where money kind of like translates into a better quality of life, having less resource is going to be a risk factor for depression because there's always a lot of mental anguish and mental energy. Another thing is loneliness, the big issue. So lack of community is the reason why we have a higher risk or higher rate of these illnesses in developed countries compared to developing countries. If you look at the how do you call it the research over and over again, developing countries have always posted lower risks, rates of depression. The reason why is that it's twofold. People believed that people were not reporting correctly because culturally, being known to have depression or have a mental illness, as you said, is frowned upon or is stigmatized. But then a lot of times people realize that when people were given the right platform, the numbers were still low. And it's because in developing countries, community is a big thing. When it comes to the family and the family like organization, there's a nuclear, there's an extended, most of them live in harmony. And there's church communities, religious communities and groups, whether it's Christian or Muslim, and then even in the workplace in developing countries, there's more of a community factor in the workplace compared to developed countries where it's very individualized and very how do you call it? Very everybody for themselves. So lack of community is one of the reasons why a lot of people have depression. And that ties in with the loneliness factor. For example, when people are married, there are lower rates of depression, especially new onset depression. So if I pick the 34-year-old male or 34-year-old female, and I compare two different cohorts, one of them was married and one of them was not married, and it was a new onset depression, it was more likely you are more likely going to find more unmarried people depressed. It comes back to the loneliness factor. Having a partner or having somebody who's always around you is a strong protective factor against depression. But generally speaking, as I said, the ball's out on that. Different research shows different things. Different research from different periods show different things. The research keeps changing. Post COVID, mental health is completely different. Mental health has been very, very sought for after COVID in every country. Is being well paid or is being better paid than before COVID, and it's because COVID unearthed what our latent issues were when it came to mental illness. COVID as a virus itself has long-lasting effects on all parts of the body, including current research showing that COVID has permanent neurological and psychiatric manifestations. So that brought a lot of anxiety disorder, brought a lot of depressive disorder, some psychotic disorders. I have a paper that I'm writing on something like that, which we should be working on very soon. So like COVID brought a biological component, and then lockdowns. People were not allowed to react when it comes to people like in person. You couldn't be around people, you couldn't be in a group. And then people take those things for granted. We don't realize that some of the worst punishments avoid and involve human beings being socially isolated. Prison, you are isolated from a lot of things. You have other people in prison, but you're isolated. If you are in prison, the worst kind of punishment you get is solitary confinement, which means they're putting you in a hole somewhere, and that's the kind of thing that breaks people. In war, when they are torturing people, isolation is one of the things that you do. So when you take things for granted because you have them, you don't see the big picture importance of something until you lose it. It's like sight. When you can see and everything, you think everything is fine. If you go blind tomorrow, it will make a big difference. You understand how sight is valuable to you. Hearing, same thing. Teeth, you can lose your teeth. You can lose all your teeth to a disease. Yeah. So the same with mental health. When you lose one aspect of your mental health, not even all of it, one aspect, depression really affects drive. If you look at all the symptoms that I gave you, the part of the person's life that really affects his drive. And there's an anthropological and a philosophical explanation behind some of the things too. For example, depression will, from an anthropological perspective, will cause like an organism, like a human being as an organism, to want to not exist anymore. So that is even your instinctual edge to survive. Depression can take that away from you. Because why would you want to kill yourself? If you were looking at other organisms that are not human, everybody has an instinctual edge to survive. It's wired in you. So for an illness to be able to take that away from you, it's a very serious thing. We're not lemmings, we don't jump off the cliff. So that's one of the things that people need to put in perspective. And I feel like post-COVID, mental health has been a big thing. So globally, in Africa, people are taking it more seriously, to the point where sometimes you wonder if people are taking it a bit too seriously, because now every small thing, every small inconvenience, people are trying to find like a mental health reason for it.
Yeah, my mental health. Yeah. I agree. I think that the term mental health hadn't been overly thrown about before COVID, but after COVID, like you said, with isolation, being socially distanced from other people that you love, like not being able to be as social as you would previously be, has caused people to, throw the term about a little bit too much. But again, like you said, people go through the mental health stages differently. And so if that's an escape, can we then totally say that everybody is depressed or everybody has some sort of mental health disorder? Is it safe to say with this period after COVID?
So to be honest, with or without COVID, everybody will have mental health challenges. Not everybody will have a full-blown illness. Okay. That's why I always use the juxtaposition with dentistry. Everybody, irrespective of if they ever see a dentist or not, by the end of life, unless maybe you die very early, will have some dental issues. Yeah. It's part of life. Whether you know dentists exist or not, you will have them. Whether you know and you want to see a dentist or not, you will have them. You understand? So mental health issues will always come. And both of us are Ghanaian. Let me give you a perfect example. You would hear in certain families that, mommy way, or this lady, she worries too much. Always over everything. She and her sisters, they're always worrying. And like, we can't even work with them because they are worrying all the time. They make everything a big fuss. And we literally just make an excuse for anxiety disorder. But it's extremely prevalent in our society. And people are going on, they are living with it is debilitating, but they are kind of like adapting to it. And it comes back to the definition of mental health. They are living a life that will not have been their full potential if they got treatment or care for it. It has been kind of like accepted and like rationalized that she can something small happening, she's shaking. But it's an issue, and it's the culture is a social cultural norms and acceptances behind the symptoms of mental illness that lead to them being treated or not, or lead to them being identified or swept under the carpet. So activism is through education. So activism is forcing people to be educated. That's my personal vision and my personal definition. You are forcing people to know what it is. You're going out of your way. There are classes where they teach these things. Those people don't have access to those classes. So you are going onto platforms where people exist, people can hear, people can like be. It's not passive anymore. You are actively pushing the important thing into people's heads so that they cannot make an excuse that I didn't know. So now we know. And activism makes a difference because most human beings are rational people. When they know and they identify an issue, they are more likely to let people know that the issue actually exists and then identify people who have the issue so that they can get care. And that is why we all need to be activists, because it's one thing if you didn't know at all, but it's a different thing if you knew but you turned a blind eye to it. That's a sin of omission. You knew to do it, but you didn't do it. People play that kind of thing compared to sins of commission where you're stealing. They're all sins. So it's our duty as activists to kind of get this information out there so that people know, and then other people can know through them. Because professionals cannot do everything, and then that's why you are really trying your best to let people know like danger signs and stuff like that. So I think at this point, I don't know. We could discuss like another illness.
Yeah. Well, I think that we will leave it for our next episode because there's more to, like you said, there's more to mental health. And in the next episode, we'll delve into why everybody should be an activist for this. What are some of the telling signs that we would see in men, women, and children when it comes to mental health, and any other information that you would like to share. But before we end this, what will be your final words to somebody watching this episode for the first time and it's like, I would like to stick with these group and listen to more things on mental health and, kind of self-assess? What's something you'd like to tell them?
So I would say for like the average person, what is causing you anguish? What is a reason why you feel like it's harder to do the daily things that you're doing? If you can identify it, you are more likely to be able to identify like a mental reason or a mental, I won't say imbalance, but you might have like a mental, is that an issue? Yes. Not an illness. You might not have a full-blown illness, but you might have something that you need to work on. And then how can I identify similar things in the people around me, people I care about, the people that I work with, because everybody's going through something. The important thing is being able to identify it. So when you identify it, then you will be able to address it. Addressing it is a whole different thing altogether. Having to address people when it comes to issues of mental health, it's a different ballgame. It's a completely different ballgame, which we'll probably discuss in an episode coming to you soon.
Thank you so much, Dr. Ralph. I really appreciate this. This has been very, very insightful. Learning about mental health, depression, kind of connecting it with dentistry, and other physical body issues that people may have. And I'm sure that other people listening would tune in next time to learn more. So guys, do well to share this information with other people. A lot of people would need this. And of course, subscribe. We'll put down other details as to where you can listen in on this next week when we do our next episode. But it's been amazing talking to Dr. Ralph, and we will see you guys in another episode. Bye.